Hello, good morning. My name is Kamal. Today I want to talk about the ETB, emergency trauma bag. So under this emergency trauma bag, there is something that we'll look at, which is the patient assessment triangle. This patient assessment triangle, it consists of many things, but we will discuss about two or three aspects of it. Firstly, let's discuss about the 3S, which is the safety, scene survey, and situation. So when we talk of the first S, which is the safety is talking about the safety of yourself, the safety of the area. And under safety of yourself, there is something we call the PPE, personal protective equipment, which you use to protect yourself from having some kind of injury, or let me say communicable disease that will affect you, which include the hand glove, the nose mask, the eye goggle. These are some of the example of the PPE equipment. Under safety, you need to have all those things in order that you'll be safe in every place you find yourself. While the second S, which is the scene survey. Under the scene survey, you need to identify what kind of incident is that. Is it medical or trauma? Is it medical or trauma? You need to specify it before knowing the action you take, or else there will be a problem. When we talk of medical, any medical issue, it could be either asthmatic issue or cardiac arrest and so on. Then for trauma cases, mostly it affects the spine injury. Mostly is spine injury. And those spine injury, it can occur either in accident or someone fell from a high tree or a high building. So definitely there is tendency that his spine will be affected. Let's go there. So in this aspect, when someone has a medical issue, let's note this. When someone has a medical issue, you respond to him immediately, then you make a call. I say again, you respond to the patient immediately, then you make a call. Once I say you make a call, you call either the ambulance and so on for them to come and assist and take him to the hospital. But you need to attend to him first before doing that. Then for trauma issue, the first thing you do in that situation, you make a call. You call ambulance, or you call a particular hospital for assistance. Then you tell them what is the situation in that place, in that particular on that call you make. It is an trauma issue. Then in this trauma issue, you make a call. Then you respond to the patient. How are you going to respond to that patient? So let's get there. So when doing all this, you have followed all the protocol on this emergency trauma bag, which is the first aid in a nutshell. So when you are checking the responsiveness of that patient, what you are supposed to do, you shout. When I mean shout is that if you know the name of the person, you call his name. Usman. Emmanuel. To see whether he will respond or not. If he did not, then you shake him. You shake the patient. If he did not respond, then you now pinch him. But you cannot declare that person, if he did not respond, dead unless some certain condition, when a medical professional has arrived. etc. We are not going to that aspect. Let's just go to a little aspect of us for we to know what to do. Then if you are suspecting to be spinal issue, what are you going to do? So when you suspect a spinal injury, I say again, when you suspect a spinal injury, you need to stabilize the cervical spine as soon as possible. I say again, you need to stabilize this cervical spine as soon as possible by holding the head in a neutral position. By holding the head in a neutral position. But there's one thing I forgot. In a mass casualty, I say again, in a mass casualty, you call out on those who can walk. I say again, you call out on those who can walk to move to a designated area that you assign to. You move them out of the place. You don't need to leave them in that particular area. So this is one of the important things we need to know. And tomorrow or next, we are going to continue from somewhere in order we can save our colleagues, our brothers, in terms of things that we can do in case of emergency at home or anywhere we are, so that they will be alive. Share, subscribe. Thank you very much.